This is Module 10 of the Emergency Medicine Clerkship Orientation Podcast, Clerkship Survival Pearls. This module will be about the various different unwritten rules of the clerkship that will be of benefit to you if you follow, and will be very helpful to your success during the 4 weeks of your clerkship. First pearl would be to be early. Many people would say if you're not 15 minutes early, you're 10 minutes late to your shift. And this is very true. The last thing that you want or that your team wants is arriving on time to, for example, a 7 o'clock shift at 7 o'clock. We encourage you to arrive at least 15 minutes early to be able to place your bag down, put your coat away, log on to your computer, get a glass of water if need be, and be ready to see your first patient at 7 o'clock so that you're not holding your team up during the beginning of your shift. This also is the case for any didactic sessions or labs or grand rounds that we may have you be required to attend during the clerkship. So again, just be early and make sure that your colleagues, attendings, other residents in the residency are ready to work with you on time at the beginning of your shift or your didactic. The next thing would be nourishment. Many people during the clerkship find it to be quite a rigorous experience, although beneficial, but many people forget the essentials of life, including food, sleep, things of that nature. So just be sure that you are ready to go for each shift, and if you need to go to the cafeteria, just let the attending know or your senior resident. We'll provide you with 30 minutes of time during any shift to eat lunch or dinner and make sure that you're well fed. The last thing that we want you to do is be hungry during the shift or not be able to have a drink of water or go to the cafeteria to get a beverage. So just let your attending or your resident know that you want to go to get something from the cafeteria, and they'll be glad to accommodate you for that. Sleep would be the next thing. Please be aware that emergency medicine, as many of you know, is a specialty of multiple shifts at multiple times of the day, which require you sometimes to do overnight shifts, middle shifts, where your sleep schedule may be thrown off. So just please, when you're at home, you're done with any studying or any didactics that you need to finish up at the end of your day, be sure to get a good night's sleep. It'll only benefit you and your patients during your next shift in the emergency department. Enthusiasm, we can't stress this enough. This goes along with working hard, which is the next bullet point, but please go the extra mile. That includes while you're seeing a patient, if they need to use the bathroom and need to be helped to a bedpan or to use a urinal at the bedside, if they need to be boosted in their bed, if they ask for a glass of water or something to eat, go the extra mile to ask your attending or your resident or the nurse that you're working with to be sure that it's okay. You provide them with that. But if you go the extra mile for your patients and to work hard for your team, that will be noticed and will be duly noted when we go to assess grades and generate a rank list for our residency. And again, working hard. This means that trying to see as many patients as possible, making sure that you do an extra procedure module or an SAM quiz, whether it's required for the rotation for you or not. It's only of your benefit and many times of patients' benefits that you go the extra mile and work hard to complete, if possible, extra didactics or extra patient follow-ups, and this will only benefit you and your patients that you see. Be helpful. Again, this is along the lines of if the nurse asks you to help her to insert an IV or to help her insert a Foley, or one of the technical partners asks you to assist to help with a 12-lead EKG. This is only going to help and benefit you in your education by learning those procedures, but it will help your staff, and it will definitely provide your staff with the extra help that they need to go along with likely their stressful day that involves multiple patients. So try to be helpful with all the staff, including your attendings, your residents, but especially your techs and your nurses and other ancillary staff in the emergency department, which you may not directly come in contact with for most of your day. Next is dressing like a doctor. We encourage you to dress either in blue scrubs, which is the color scrubs we wear in the emergency department, or a shirt and tie for men or appropriate professional attire for women. The last thing that your patients or the staff in the emergency department want is someone who comes dressed unprofessionally for a shift, and that is obviously picked up by patients and other staff in the emergency department as being unprofessional. So we encourage you to wear either the blue scrubs or with professional attire that you would wear to any other rotation with your pressed white coat and your ID showing on the exterior of your coat so patients and staff know who you are. Finally, one of the most important points of the clerkship is treating Dawn Yenser and Donna Bigelow as your mother. And this might go without saying, but they're the brains of the operation, as you will, behind the clerkship and the residency. These are the women who perform the day-to-day organizational tasks of the residency and the clerkship, including making your schedule, including making sure that labs and didactics are set up. They're the ones that are taking your schedule requests, and they're the brains behind the operation. Any hint of unprofessional behavior toward them or anything that they perceive as something that may be very high maintenance for a student will be duly noted, likely by them. And as you well know for other rotations, if you don't treat your office staff within the residency or clerkship well, that will likely come back to haunt you later in the residency process. For histories and examinations, we encourage you to do a very complete history and exam. For example, if you have a pediatric patient that, say, is 1 year old, and you come out of the room and you haven't asked mom about immunizations, about their feeding schedule, about their birth history, that would be an incomplete history. So please take a complete history on all your patients. You should be able to do this within 15 to 20 minutes of each patient encounter. And as you know, in emergency medicine, we like to know pertinent positives and pertinent negatives of their history. So if someone comes in with chest pain, we'd like to know whether or not they have shortness of breath or diaphoresis. Whether or not they have it or not, that would be a pertinent negative. And for your examinations, again, be thorough and complete. If someone comes in with altered mental status or stroke-like symptoms, you would obviously be incomplete if you came out and didn't do a NIH stroke scale score on them. Or for a patient with abdominal pain or GI bleeding, if you didn't perform a rectal exam, that would be an incomplete exam. Your case presentations, we want you to be succinct and organized and emergency medicine specific. Meaning that, again, we want the pertinent positives and negatives of that chief complaint, and we want it to be organized. So in terms of age, sex, chief complaint of the patient first, a brief history that includes pertinent positives and negatives, their vital signs, then a full history, a full examination, any lab tests that may be back, reviewing any images or studies that have been performed at that point, and then, as we go into the next bullet point, generating an expanded differential diagnosis. We encourage you to at least have 5 diagnoses on your differential. And we'd want you to list them, obviously, in order of severity. So if someone comes in with chest pain, we would obviously want you to be listing the 6 most common causes of deadly chest pain diagnosis as your differential. And then if you think it's something else, we'd want you to list those second. But please have an expanded differential on all the patients that you see. It will only benefit you to be able to generate that differential and think about those possible diagnoses, and it'll show the residents or the attendings that you're working with that you've thought in depth about the potential for any severe differentials that are there, and then possibly your most likely differential at the end. And this plays into the next bullet point, which is have a plan. The last thing that we'd want you to do is come out of the room and just provide us with a history and a physical. At this point in your careers, we all assume that you're very good history takers and physical exam takers. What we want to make sure that you're able to do at this point in your career is synthesize that information and generate an expanded differential and have a plan to either rule in or rule out the things that are listed on your differential diagnosis. So when you present the patient to the attending or the resident, as part of your presentation, we would want a history, a physical, the lab tests, the studies, your differential, and then your plan to then rule out those differentials or rule in those differentials with further studies, lab tests, or further physical exams. There's multiple things on the Clerkship website in terms of resources that you can use to help research topics or generate those differentials on shift. You can refer to the Clerkship website to see a list of those. The most common ones we'll use in the emergency department are things like PEPID, DExplain, the NNT.com, just to name a few. Please use these resources. They're there for you and to help you organize your thoughts and generate a differential diagnosis which is thorough and complete for each of the patients that you see. These resources can also be used to research topics after your shift if you see a patient that has an interesting presentation or diagnosis, and it can also be used to generate your case presentation at the end of the clerkship. Now, just in terms of some housekeeping items, please be sure that you don't schedule too many requests in terms of days off during your rotation. Donna Bigelow will send you an email ahead of the start of your clerkship, and that'll be your opportunity at about 1 month prior to your clerkship to send her back any requests. Both Dr. Gerald and Donna will try their hardest to accommodate any schedule requests, and you'll be notified if they're unable to be satisfied. But please, the last thing that we want you to do is, if you have 4 weeks in the emergency department, that you have 15 requests off. That obviously will not be able to be accommodated. And the reason we'll send you that email 1 month ahead of time is so that we avoid having any last-minute schedule requests. Now, obviously, we understand if there's some sort of life event that occurs during that time period before your clerkship or during it, and we will obviously accommodate you for those major life experiences that you need to have off for. But the last thing that we need is to know that you need to be off, for example, to take your dog to the veterinarian the day before you have a shift. We would hope that that wouldn't occur and that you would have let us know about that the month before when the email was sent. Finally, the most important clerkship pearl are two things. One is to refer to the website with most any question you have. We've spent many hours developing the website so that we have virtually all the information there that you may need during the clerkship. So that would be your first contact point. If you have any question, look at the website, look it over very thoroughly, and there should be an answer to most questions. If that's not the case, we encourage you to then contact Dr. Gerald or Donna Bigelow, and they would be glad to assist you with any other questions that you might have. And finally, the checklists. Each student that comes, you will know what part of the clerkship you're enrolled in, whether it's the enriched or the core or the visiting resident part of the clerkship. Each of those subsets of students will have an appendix attached to the clerkship manual, which is on the website, and on there there'll be basically a to-do checklist. Please refer to that at the beginning of the clerkship and even 1 month before when you know that you'll be coming. And this will very specifically lay out the requirements for the clerkship, and that way there'll be no confusion between you or the clerkship team as to what is required of you to successfully complete the clerkship. So please refer to the website, and please refer to those checklists specific for the rotation that you're enrolled in here at Lehigh Valley Health Network Emergency Medicine Clerkship. This ends Module 10 of the Emergency Medicine Clerkship Orientation Podcast.